I'm trying to say.
Down the hall around here.
So do I wait for Don to come back? Do I go?
I think we can go with this.
It was right here. I didn't trust him to sit right for the funny.
Okay, well, I guess I'll go through a quick introduction about myself. Not too long, so it's not too boring, and then we'll kind of jump in. I really didn't have a lot of parameters for this, so I'm kind of winging it a little bit. Came up with some basic notes, but my thought was whatever questions you guys have, I'd rather get those answered and get any specifics, and then we can kind of work our way. I can always find something to talk about. So I am a licensed clinical psychotherapist. I won't go into what that means in great detail, but the state of Kansas gave me a piece of paper that says I apparently know what I'm doing at this point. I've been with Responsive Centers, which is a private practice group in Oakland Park on College Boulevard. It's kind of 8 years now. So basically that's where I've been since I graduated with my master's degree. I work mostly with kids, all walks of issues from depression, anxiety, anger, stress, school, ADHD, autism, Asperger's. Do some drug and alcohol stuff because I work with teenagers and not a substance abuse specialist, but it just kind of comes up. My personal practice is split about 50-50. Half the time I do basic general kind of talk therapy. The other half I focus more on evaluations and assessments, which might include IQ testing, ADHD evaluations, Asperger evaluations, or kind of more comprehensive level 2 and level 3 psychological evaluations for hospitals and the juvenile court system and those types of things. Because I'm a relatively young guy, I would say I work mostly with boys because their parents feel like that would be a good connection given that. So it seems to work pretty well. And then a little bit personally, I've basically grown up in Kansas my whole life. I've been in the Johnson County area since I was 8. Parents still live in the same home. We moved here from Wichita when I was 8. Sports guy, grew up playing sports, so a lot of kids that like sports, those kind of things tend to connect fairly well with me, but then I'm also jokingly a self-proclaimed nerd, so I kind of like the academic side of life as well, so a little bit of both. So that's just kind of a quick brief about me. Married 12 years, 2 kids, a 7-year-old and 5-year-old daughter. So that's been an interesting adventure because I'm the only guy at home. So kind of learning all those has been nice too. Okay, so I was told initially this was going to be an ADHD talk, and then somewhere down the line we kind of threw in, hey, can we talk about Asperger's autism spectrum as well? So I said, sure, why not? So I'll try and kind of basically run through some very basics on what ADHD is, what is Asperger's and autism, and then once we kind of lay that out, we'll kind of just go from there and answer any questions and kind of make the conversation as relevant as we can. So ADHD stands for Attention Deficit Hyperactivity Disorder. There are technically 3 subtypes, but most of us kind of use the 2 subtypes the most. There is the combined type, which is both inattention and hyperactivity, which I think is what most people in the general population think when they hear ADHD. So these are probably the kids more that have a lot of energy, tend to fidget, tend to struggle sitting still, impulsive, blurt things out, and then they also have the short attention span, difficulty focusing, get distracted easily, those type of things. The inattentive type looks very different. They are not hyperactive at all. And actually we're kind of seeing that a lot of them are even on the other side of the spectrum when it comes to energy level. Some of them are kind of more lethargic and tired. So they tend to just kind of sit more, daydream, space off a little bit more. They're not disruptive. They don't get identified as easy or as young as children with hyperactivity. The hyperactivity combined type is more common in boys, the inattentive type is more common in girls, but both can have either one. So boys with ADHD probably are going to be in someone's office by roughly 5 or 6, maybe. They maybe gotten kicked out of preschool or kindergarten. You can kind of see the behaviors. They're a little bit easier to diagnose at times. The inattentive type is harder to see, so sometimes they're kids that kind of go under the radar. They're sitting in class, they do okay academically. I've had some that aren't diagnosed until late high school years, which is definitely not ideal. But they've gotten by long enough, and then finally something kind of just pushed them or their parents over the edge to say, let's go get assessed. ADHD is considered a neurobiological diagnosis, meaning the brain looks different for someone with ADHD than someone who does not have ADHD. Most of that lies somewhere within the frontal lobe, where we have those, what you commonly hear, executive functioning skills, which is the problem solving, impulse control, those type of things. Because of the biology of ADHD, that's why medication seems to be the best treatment we have. This is probably the only diagnosis as a therapist I will say that for, but it is. Behavioral programs have benefit, and we use them in conjunction with medicine. But if medicine doesn't work, if it's a child that doesn't respond well to it, they have a much more difficult road than someone who does respond well to medication that is ADHD. The medications are time-released. They're a very unique medication compared to what most medications we take that are, you take them once a day, they last 24 hours a day. These medicines are lasting between 6 to 12 hours. You're really lucky if you get 12 out of it. 6 is on the short end, that'd be more like a fast-acting Ritalin. Most of them are probably somewhere between 8 to 10 hours. So, for like what you guys do, if you have evening meetings, if their little kids are coming in at 4, 4:30, 5, campouts, by that time, their medicine is no longer in their system. So their behaviors are going to revert back to what they were. So we're going to start seeing more of those impulse control, hyperactivity. If it's real bad timing with a meeting or a function and they're kind of on the crash off their medicine, you might see more emotional responses and those kind of struggles too, because some kids kind of do crash when they come off of their medicine. Kids with ADHD tend to do much better with structure, routine, predictability. There's some research that says adults with ADHD or young adults do well in the military because of that rigid structured nature that the military provides for them. They're going to need more redirection, need more prompts. They're going to get in trouble. They're going to feed off the environment as well. So the higher energy the environment is, the higher energy they're likely to be as well. So if you know you have 2 boys that are ADHD, I would recommend not sitting them right next to each other. They are going to just feed off of each other, start disrupting the group. Group's going to start getting mad at them, and kind of goes downhill from there. They'll need more breaks. If they're doing something where you want them to sit for 30 minutes, if it's at 4:30 or 5, they're not going to want to be able to sit for 30 minutes. So they might be able to go 15 minutes, and then need to go get a drink of water or something just to get up, move around, redirect, and then kind of come back.
You've just described our entire Cub Scout package. I'm not kidding, that's 100% of it.
As far as diagnosis or prognosis, there's about 9.5 to 10% of children are diagnosed with this. So I don't think it's as prevalent as the pop culture or mainstream media try and make it. It's not 20, 30% or whatever numbers some people try and throw out there. It's about 9.5 to 10%. We also know a lot of these kids tend to be a little more immature. So they may chronologically be 7, 8, 9, 10 years old, but probably socially, behaviorally, some things that are going to look a year or 2 younger at times. So that can create some social aspects. Like most things, I'd argue it's a spectrum. Some kids with ADHD they're very likable, they have a very sweet personality, it's just they're hyper and inattentive. Some kids with ADHD also have more of the behavioral component, so they just tend to defy and push rules more. Maybe they just decided they've been in trouble so many times, that's just the way I'm going to approach life at this point, especially if they've been unidentified or undiagnosed and we're getting into the 9 or 10-year-old range for a boy with ADHD. They're going to be a little frustrated with the role at that point because they're constantly being called out. And a lot of times when you ask them, why did you do that? The answer you're going to get is, I don't know. And some of that's viable. If it's an impulse issue, there was not a conscious decision to do that behavior. So when you ask them, they don't know because their brain didn't tell them, hey, if you do this, this is going to happen or you're going to get in trouble. It's, I do it, and then my brain catches up, and now I'm in trouble. But I don't really want to admit to it because I didn't really need to do it. So that's a real quick ADHD. They're intelligent. There's nothing, they're smart kids. Their grades often don't reflect their level of intelligence. They tend to be pretty creative, at least my personal experience with working with numerous kids in my office. They build things, they're artistic, they see the world sometimes differently. So there is some advantages to being ADHD if you learn how to manage it, whether it's with medicine as you get later in life, other ways. I would probably argue there are some professions where being ADHD would be highly beneficial. Being an emergency room doctor and having to bounce from one activity to the next, not having to finish something. Probably some lawyers out there that are ADHD, they got 12 cases going at one time and they can literally bounce from one activity to another, completely forget that case and go to this case, completely forget that. Someone like me, some more anxiety, OCD as I jokingly call myself, I I don't function well in those environments. I want to start something, finish it and complete it, and then move on to the next task. So there are some advantages to it. They do tend to be creative. They are intelligent. Just a lot of times their behavior gets in the way of seeing sometimes how smart they really are. You want me to talk more about Asperger's or autism? Or
Well, is autism amongst this group an issue? Do we have kids with autism? I know we've got one in our pack diagnosed. So maybe, what can we do to help these kids get more out of what we're trying to teach them?
Okay. I'll kind of first up. So there's the term autism, and then there's this term Asperger's. And then to really confuse things, our new diagnostic manual took out the term Asperger's. It will no longer be a diagnosis. It will all be now considered autism spectrum disorder, or they came up with some new social pragmatic disorder. They came up with some new terminology. So just as everybody caught up to what Asperger's finally was, and they kind of separated it, they just American Psychological Association and Psychiatric Association decided to change that. The big differences we typically think is a child with autism is typically going to be developmentally delayed. So their speech they're not going to develop speech on time. Some children with autism don't develop speech ever. They need a lot more assistance. Children with autism generally are probably maybe lower cognitively IQ functioning, although sometimes that's hard to assess because a standard IQ test isn't going to really work that well for them, but that's kind of considered more in the autism range. They have more significant social issues. They really can be literally in their own world, have no desire to come out of that world, and you have to force them to come out of that world. Asperger's is more of the social. So cognitively, intellectual-wise, we consider them usually average or above average. They develop communication and language on time developmentally. They just struggle socially to kind of fit into the world. So that where autism and Asperger's are similar, there's that social component. So children with Asperger's they're gonna have a hard time reading body language. I asked one time I asked the kid with Asperger's, do you know what I mean when we say body language? And he looked at me like I was nuts. Like, how can your body have language? Because they are very literal in their concepts and processing the world. They're black and white, all or nothing. Gray area rarely exists for them. They will often have their own set of rules. They will come into a situation with their own thoughts and rules, and when the world or the environment doesn't fit that, they struggle with it. As they get older, we are seeing more as the children with Asperger's kind of start noticing they're different and start struggling with that. There are many, as they get in their teen years, they want to have friends, but they don't know how to do it, and they don't know that the behaviors they display are even turning off or upsetting others. Children on autism spectrum spectrum usually have limited interest. They can they'll obsess and focus on one thing at a time, maybe for many, many years. They love routine and structure. They do not like change. So if a meeting is supposed to be Tuesday at 7 and Tuesday at 5, you change it to Thursday at 7, mom and dad are going to might have a rough night at home because they don't like those types of changes. They like to know what's going to happen. They like that predictability. Kind of jokingly, if you want to think out there in the world right now, I don't know if you've seen Big Bang Theory. People kind of laugh. Sheldon Cooper, although genius, so that creates some of his social, but people kind of laugh at many of the quirks he's displayed on the show are very Asperger-like. Again, just a complete unawareness of how he says things offends other people, or that the world doesn't kind of revolve around him in a sense. And then, in my opinion, it was a little over the top, but the most classic representation of autism would have been Rain Man, when Dustin Hoffman played the character. Now, very unusual because he had multiple savants, and he could do, most children with autism don't have one, he had more than one. But I thought he did a really good job of kind of showing some of those rigidities and taking them out of their comfort zone, the sensory issues when he's in the casino, and the noises and the lights. So again, where kids with ADHD might feed off of that sensory and enjoy the noise and build up with it, children on the spectrum, as the situation gets louder and louder, they start shutting down more and more. So that's the difference in how their sensory issues affect them. So that's a real broad overview. Quick version of ADHD and kind of spectrum. So before I just kind of, I don't know, just start ranting on things, I mean, are there specific situations you've had occur or children in your mind, you're like, what do I do when they do this? And I want to make sure you guys feel like you get something out of this. Are there any questions you guys have at this point about even just generals or children you have?
Well, starting at the den level, you have den with 4 kids that are basically streamlined and one either Asperger's or ADHD child. What are some actual key tips and tricks that you can use to help integrate that child into the den's activities?
So we have 4 kids, 3 are
Streamlined.
typical, and 1...
Doing what they need to do.
So and what age, I mean...
Well, anywhere from 2nd grade through 5th grade is what we've seen. Personal dens that I ran.
Right. Well, one thing, we'd say, okay, if we had 4 kids, you have a kid with ADHD. As far as the times that you're in charge of them, again, we're going to argue, even for both diagnoses, the more structured the environment is, the better that child that's been diagnosed is going to do. Children with ADHD tend to get themselves in trouble in downtime and unsupervised, unstructured activities. So when we think about school, I can usually predict if a parent comes in. It's lunch, it's recess, it's music, it's art, it's the classes where there's not as much predictability, structure, the child doesn't know necessarily what's going to happen, the situation is louder. If we're presenting them with a task, if we're asking them to make something or do something, we want to hit kind of on all their senses. So we want to make sure there's a visual component to the teaching, an auditory component to the teaching, and then once you send them out, that kid with ADHD, you might want to go back up to it and say, do you need me help? Do you remember what we're doing? Because half of what you said may have gone in and stuck, and half of it may have gone in and out. And then you put him there, the other 3 kids are rocking and rolling, they're doing what they're doing, and he's sitting there lost. And if it's a boy, they don't typically like to admit to their weaknesses as much, and so they'll tend to start acting out more, kind of, act like they maybe don't care, it's not important to them, not maybe as willing to ask and say, I don't remember what we're doing, I don't get that. And so if we kind of follow up, we always kind of say to kids, ADHD is short and sweet. If you give them a 20-minute introduction and lecture into what you're doing, about 3 minutes into it, you've probably lost most of that at that point. And then again, it's just kind of more redirection. If you're kind of walking around watching, you may be spending more time kind of just hanging around him, just, because you might start getting fidgety. Allowing them to fidget. Sometimes I even tell parents, like, send your kid with a rabbit's foot or whatever they play with in school, help them to fidget. Let them bounce their leg. It might be hard for the kids if they're tapping their pencil, but to try and not pick all those battles and helping the kid understand, this just helps him process this something. Maybe making sure there's distance, so that he's not as easy for that child with ADHD to kind of get into other people's space and boundaries. And then again, just allowing for breaks. If it is something that's going to take a little longer, children with ADHD are going to make more careless mistakes. So if it's something that has more attention to detail and things like that, following up, making sure they're kind of on the same page. If you have a peer that's really good and patient, you might put that one next to them. And just see if that, sometimes kids are showing that they want another kid helping them out. Sometimes kids don't want another kid to help them out. So I think it's kind of reading the personality. And again, the personality of the kid with ADHD, because again, their personalities are going to be different. Their symptoms might be similar. They're fidgety and they're hyperactive, but again, some are pleasers and some want to do well, and some have that more just genuine, likable personality. So they're probably more willing to take direction from another student and you might have some of them more defiant, push rules a little bit more, and so they may need more of the authority figure to be the one that's kind of keeping them on track because they don't want to hear it from peers. They may not want to hear it from you either. And then usually I say to kids with ADHD, if they give you a quick reaction back, even verbally, we know that some of that's also impulsive. Kids with ADHD are going to say no, like that. No conscious effort to it. And so I tell parents all the time, don't respond to that initial response. Give them 10 seconds. Let their brain really process what you ask them to do, and then say, hey, can we maybe get back to and then you might get a different response. But if you react right away to that no, and it's a more defiant ADHD child, then they're gonna look at this as a now authority battle, and I'm going to try and win this authority battle. So sometimes when impulsivity can just be what they say. And that's what gets them in trouble when they blurt things out and they say things. They may often, so even it's hard for the kids, they may blurt things out to the kid and just kind of say, we don't need to react, just ignore those types of behaviors. You don't need to come tell me every time Johnny blows a bubble with his spit or whatever impulsive behavior he's doing. If he's still working, we'll just, that just is kind of how he processes. A kid with Asperger's or autism could be different. They may want to be just completely disengaged. So if you have 4 and you kind of give them an activity, they may prefer to just go off on their own and do it. They don't even want to be around the other 3 kids. And so I would say if you were able to get them to sit there for the first little while during the directions and kind of got them to buy in a little bit and they know what they want to do and they want to go sit by themselves, I don't know if I'd push that battle. That's their comfort zone to work because again too, they're going to be more sensory sensitive to things going on around them. And so if some kid is, so if you have an ADHD kid sitting next to an Asperger kid and he's sitting there doing this, the Asperger kid is like, that's like somebody taking and just bong and chimes right in his ear. So it might be, if he works better there, and then as soon as he's done, we have him re-engage in the group. We don't want him to completely isolate himself, but to know that they may need that time away a little bit. And then again, recognizing if we know it's going to be a really kind of loud situation, and we have a kid who's been identified on the spectrum, they may need an extra break here or a chance to get away from that stimulated environment. Again, kids with Asperger's, if you challenge them too much, they're going to shut down. I mean, they're going to just stop talking. And so it's again kind of just helping them get away, let them process a little bit. They'll usually re-engage. If we force or push it too much, again, they can have their own, like any kid, they have their own little opposition. If they feel unsafe, or they feel like this is going to be a harmful situation to them. A lot of kids with Asperger's, I also did say that a lot of them tend to be rule followers. So if you say this is how it goes, then they're going to do it exactly how you told them to do it. And then the kid with the ADHD is like, wait a minute, I can bypass step 2 and get to here. And if a kid with Asperger is sitting next to a kid with ADHD and sees him break the rules, things are going to go badly because we are going to point it out, and then the kid with ADHD is going to blurt something out that's not very nice or mean to the child with Asperger's. They're not going to know how to manage or take it. They're going to shut down. This kid's going to get yelled at and get in trouble, and the entire group is lost.
This sounds like our son all in one.
So I think sometimes it's, I would say it's knowing, if you know your kids, and if you know they have a label or diagnosis, maybe, okay, Tommy with Asperger's doesn't do well when he sits next to Timmy with ADHD. They fight about the rules, and he's always making noise and doing this, so maybe we'll try and separate them a little bit more. You did also bring up a point. You can have both diagnoses. So a child can be diagnosed with both ADHD and Asperger's. So now you're having a kid that's got sensory issues, social issues, and they can't sit, focus, and pay attention. And so, again, it's just trying to help. It's a lot of trial and error. I mean, it really is, because every situation is fairly unique. And so it's kind of saying, okay, in this environment, I'm going to try this. And then they fail miserably.
So one key tip would be work closely with the parents as a den leader to find out what works, what they need.
Yes. I mean, I would say if you have a child that you know has been diagnosed or identified, the first thing I would do is go to the parent and say, what advice do you have for me? Because odds are if they have a child who's been officially diagnosed, they've worked with professionals, they've done trial and error for years and years on their own, maybe before they got to the professional. And so they may have some general tricks as to how to manage those type of things. And then it is just trial and error. And I think that's so difficult because you may nail it one time and got it. The environment's just slightly different and you try the exact same thing.
Yeah, teamwork is one of our biggest issues. Because we've got a gifted ADHD kid who's showing some signs of Asperger's and anxiety. So he's got all sorts of things going on. But teamwork is a big issue because everything that we do in Scouts is teamwork. And when we go to camp and he's asked to work on a project with other Scouts and they don't like his idea and so they don't follow it, well then chaos. So I think it's a good thing for leaders to understand that not every kid is going to be able to function in a team.
Right.
And sometimes it's okay to let a kid do a project by themselves.
Yes. Yeah, well, we would definitely say the kid with ADHD would probably be all about it. They're usually pretty social, gregarious, but they're not really good at it either. So they're going to be, again, they're going to be that impulsive jump in and go, go, go. And so they may be already trying to set up the tent before their team or their partner has even gotten the directions out, who wants to kind of do this by the directions, and the kid with ADHD, we got to just say this, we'll be the first one's done, we'll be the first one's done, you know. And then again, yeah, so the kid with Asperger's might be, you know, going in and thinking, here's how this is going to go. He's going to already have that plan in his mind, and then as soon as it deviates, we're going to shut it. So some of that might be also encouraging parents, if they have a child that's on the spectrum, you know, say, we're, you know, camp out, we're going to be setting up a tent. Here's the instruction, you give it to the parents, and this is what we and the kids. This is kind of how we ask them to put up the tent. You know, so that they can start working on that with their child and making sure that the expectations are at least somewhat appropriate. We can't predict the behavior of the other kids, and so it still might be working. And so that's where we also talk a lot about what we call pre-teaching, where it's trying to set the child up to be successful in the environment. So kind of letting them know, this is where we're going to be, this is what we're going to be doing, this is the time frame we're looking at, but being careful that if you tell a child with Asperger's, depending on their level of severity, that the time frame is from 7 to 8, and the time frame is from 7 to 8. And when 8 o'clock hits, if we're not done, and you told me we were done at 8, then we may not handle that very well. But again, Asperger's is unique, I mean, because it's a spectrum diagnosis, so they look very differently. They're very severe Asperger's kids, they get to be more rigid, struggle much more socially, and be more in their own world. It's just kind of somewhat, might just be quirky, you know, maybe do some things that kind of seem, I don't know, but yeah, they can get in there, they can kind of manage their own, the world kind of doesn't always fit exactly what they're hoping for. And that's the same with ADHD. You can have a kid, I have a kid walk in my office, and I could guess within the first 10 seconds why they're in my office as a first-time patient. And then there are kids that are ADHD that I have to jump through several levels of evaluation and assessment to kind of finally rule out and feel like I think that is the accurate diagnosis. Same with kids with Asperger's. There's been times, you know, you can kind of get that, what we call it, more classic look, and I can be like, I think I know what we're here for. And then there's been times that parents, you know, who've told me before I met with him, like, he's already been diagnosed with Asperger's. I've done an initial appointment with him, and I told the parent, if you hadn't told me, I'm not really sure I would have guessed at this point. So enough skills to fake it, at least at that point. So it is a lot of trial and error. I mean, even in therapy, that's a lot of what we do. It's kind of, let's try this behavioral component, let's try this. If this works, great. If it doesn't, then we figure out how we kind of tweak it. And then, of course, as they change in age, and I'm sure, and hormones change, all those things start changing too, and so things that were working really well may not. We see that with medicine. If a child ADHD is diagnosed younger, started on medicine at 6, I've had kids, you know, were lucky with 3 years of just basically pretty much the same medicine, same dose working, hit that 9 or 10 pre-adolescent phase, a few hormones and chemicals change, and all of a sudden the behavior start coming back, and then they have to be adjusted. And there is no medicine for Asperger's. You can help with their anxiety or OCD features with some of those, but the social skills are just something that have to be learned through practice. So like in situations, I usually do encourage like parents, you know, if a child with Asperger's is playing on the playground and you see them make a major social error, you can tell they're completely oblivious that they just totally offended the child that they were playing with. We now encourage to discreetly pull the child aside in the moment, point it out to them, teach the skill, and then put them back in. The sooner and closer it is to the situation, the sooner they can get back in and try it. What struggles is if it happens then and then we wait 2 or 3 hours later till we're at home, they may get the concept, they may get what you're teaching them at home, but you taught it to them at home. And then 2 days later when you finally get back to the park and you put them in the park, that generalization isn't going to be there. So the more the environment that's taught, whatever environment we want it in, the more they can also generalize that concept within the environment. That's why a lot of times we encourage schools to do social groups at schools for children with Asperger's or ADHD that are struggling socially, because it's in that environment so they can take those concepts and apply them directly. So I mean, I'm sure with what you guys do, the nature of being outside and moving and active, some of it's going to be great for kids with ADHD, some of it's not. Some of the more maybe arts and crafts things would be great for kids with Asperger's. Some of those other things are not. Again, I would probably say we see a lot of kids with Asperger's. They're not really into the whole athletic coordination aspect of things. So things that take more of those concepts are a little more difficult for them.
We have, with a couple of kids, found that in those situations where we want to play a kickball game as a group, to let that kid be the scorekeeper, to give him another job.
And basically that's what, any way you can keep them engaged. And knowing that for them, that might make their day. They don't want to go out there and kick the ball because they can't kick the ball. And then they know they can't kick the ball. Last time they were at recess, they kicked the ball. 3 of the kids laughed at them. One threw the ball at them. And so they don't want to go kick the ball now, not knowing that maybe that's not going to happen this time because it's a little bit different setting. So it's safe to just be scorekeeper. And then you start cheering on kids and develop, get integrated within that. And then sometimes if you let them scorekeep for a while and then maybe they get a feel for it, then you come around and say, hey, can I get in there and take your shot?
And there's a game that we play at day camp that's human foosball. And we have a fenced off area and ropes going across it, and the kids hold onto the rope and kick back and forth. Some of these kids like to be the one on the outside throwing the ball back in when it gets kicked out. And that's an okay place to be for them.
Yeah, so those are really good examples of just, again, trying to say, what can I do in the environment to help them feel comfortable? Because as long as they're engaged some, parents are probably going to be happy. Because this may be a kid that they're not in Scouts doing that, they would want to be just sitting at home playing video games or building Legos and completely isolated. So they're just happy that their child is engaged in an activity, somewhat socially, maybe even more if it's in a parallel sense, but at least they're there. And of course the hope is the more you get them out, they make a connection with someone. But if we scare them, if we make it something that they completely dislike, then they're going to go home and tell Mom and Dad, I don't want to do this anymore. Because if they don't really see the benefit for them, they're not going to want to do that. Again, a lot of times they kind of see the world differently. I always kind of think about, I had this kid, when we do ADHD testing, we use a computer test to help kind of diagnose it. So a kid with ADHD, and you sit there and watch them, they fidget, they can't focus, you can see it. I had this one kid I was assessing who eventually ended up on the spectrum. His was different. When he sat down, he just kind of looked and said, why am I doing this? I don't want to do this. And even when I kind of said, well, this is going to help me, kind of figure out, well, as soon as I said that, I should have known I lost it. Because if he doesn't see the benefit to him in his world, then there's no reason to do it. So he just kind of sat there and let it go. Not in a mean-spirited way, but you just could kind of tell his thought process was, I don't understand why I'm doing this. There's no benefit to me. I don't see what's going on here, so I'm just going to kind of disengage. As soon as we got done with it, we walked back to my office like nothing had happened. And he's like, all right, Lane, so do we get to play a board game today? Not aware that he completely did not do a task that I asked him to do. Now, I didn't get mad. I was more interested in watching the behavior, but no idea that in theory that was somewhat of a defiant act in his mind. It was just, this doesn't make any sense to me, I don't want to do this. And then it was done. Okay, now can we go back to your office and play a game? Because that's usually what we do at the end of the session. So it was just kind of interesting to see the difference even in that aspect of what an ADHD kid might look like compared to a child who's been maybe more on the spectrum.
And a lot of the things in Scouts are very repetitive. Every year we talk about conservation. Every year we talk about fire safety. And these kids are like, some of them, I've already learned that, why are we talking about it again? And so I have to say, well, last year we just discussed turning off light switches as a conservation. This year we're going to talk about other ways you can. So you have to sometimes think for them.
Right, or even engage them. If maybe they've been and sat through 3 of these talks, they're a little bit on the older side, maybe you can say, well, how about you tell us what you remember? And they may just love getting up there and telling, because they probably do remember it very well, very strict, by the book, and they're going to get up there and probably teach it as well as an adult might. And again, that's just a nice way to engage them and then say, okay, now we're going to learn something new, and then go down and take in the new information.
Which brings up another topic. When they get to Boy Scouts, and you've got boys teaching boys, one of our concerns is how is that going to work? Because older boys are not mature enough, and they may be, you know, a senior in high school. They're still not mature enough to handle a kid who's got special challenges. And so how does it work in that situation?
Well, my encouragement, because I've even had this come up with some classrooms that I worked with, where I've kind of encouraged, through the parents, I'm like, educate the other kids. I think sometimes parents are very worried about, but I have kind of found if other kids kind of know, and that's what makes Asperger's and ADHD difficult, because they don't look different. When you look at them physically, their appearance is generally the same. One of the great things when I was reading an ADHD book, talking about being a parent of a kid with ADHD, maybe undiagnosed at 4 or 5, is think what it's like to be them in a grocery store. Other 4 and 5-year-olds running up and down the aisles and climbing on things, and get all these dirty looks from parents because they say, you're just a bad parent and this kid's ADHD. But if that kid had Down syndrome, you get a very different reaction from the general population. You're like, because you can see that there's a difference. And so I think a lot of times for kids, especially as they start getting older, when we're younger, we're a little bit nicer. And then we start getting 9, 10, 11, 12, those quirky, weird things aren't funny anymore. We don't get it, and they don't look different. So other kids that are typical are kind of saying, I don't understand how he says that, or he talks about Pokemon for 12 hours if you let him. Pokemon's not cool anymore. We're 12 now, or those kind of things. And so I think as long as, of course, the parent would have to be okay with it, but in like an older situation, to go to who you think is going to be when teaching and say, can I clue you in on something here that might help? And it's a risk, because I guess they could run with it just the other way, but if they don't know at all, we probably can pretty much predict how the outcome's going to go. So it's kind of like...
You should encourage your parents to interview the different troops, because different troops have different levels of tolerance for that. Some troops, they accept it wide open, because half their kids are special needs and different. Some troops, they really don't have the space for that, and so we're going to do it this way. So have the parents who have some difficulties, be sure they take advantage of that week close here and interview every troop they can, and talk to the scoutmasters, talk to the senior patrol leaders, and bring the kid along and see how well they integrate, and see what the other older geezers in the troop can do, and what they feel about it, and things like that. So we've talked to lots of troops over the years, and they all have different attitudes about it. Some of them, they really only focus on special needs kids. They're like, no, we won't take a kid that doesn't have a problem, because this is what we do and love and have to pay what they're out of. But
well, some kids might surprise you, where I think you may, again, I think some kids, I've worked with some kids that are maybe a little more defiant, or these whatever labels they've been put on them, but the parents say, but when they let him go to the special ed room at school, he's great with it. And so again, I think we underestimate that even though some kid might be a little bit defiant with authority and rules like that, that doesn't mean they don't like society. They don't like authority, but if you give them a chance to be kind of the authority, and a lot of them will kind of surprise you that in certain situations they end up doing really well once they kind of know and recognize there's something else going on here. They kind of like that responsibility. But again, the tough thing, like some people, you can't predict the behavior of others. So you may think you have a kid that's going to do really well with it, and may crumble, and you have a kid that you think is going to be poor. So a lot of it's, I think, again, asking the parents how much do they want to weigh the risk and reward of sharing what information that may be shared. I'd like to at least think with leaders and other adults, parents would feel comfortable sharing a little bit about their child, and that most adults would be accepting any information to make meetings and things go better would be of help. And again, when we talk about kids with Asperger's, when I was in class one time, I said, you could meet 1,000 kids with autism and Asperger's, and they may all be a little bit different. So again, we know the generalities of symptoms, but they each present so very differently that creates an ongoing kind of, again, trial and error and challenge when we look at these kids. And then again, if you recognize a kid like with ADHD who's doing really well, and then all of a sudden he starts falling apart, run with the clock, because then maybe he's on extended release medicine. I was working when they got there, and within a half hour is now completely out of their system. And again, just helping manage that. Maybe it's okay, now I need to give them more breaks, maybe we need to let them take a break and kind of, because again, some kids when they come off the medicine, they crash. And parents are going to talk about it. It's a rough 30 minutes or 45 minutes as their system reacclimates and they're a little bit more emotional, a little more grumpy, a little bit more defiant, but then kind of once they get back used to being where I was before the medicine was in my system that morning, then they can kind of at least get back on track a little bit. So some of them might be also the time of day and those kind of things. Even for kids with Asperger's, if they've just had a really long day, busy day, it's a lot of tests, or there's a lot of stress at school or other environments, and then they have this, they may have more difficulty. And I would argue that would be for a child who's even typical. So even how I say we all have bad days and good days, no matter whether we have some official label or not. So some of these kids are going to come in, they're going to have really good days, and some are going to come in, they're going to have really bad days, and there may not be a rhyme or reason why. It's just where they were at that day.
Donna brought up a good point about kids with anxiety, and it sounds like a lot of the tactics you apply with ADHD or Asperger's autism spectrum, would you say they would cross-apply to kids that have
You can definitely apply some of those things, anxiety. I mean, kid anxiety is going to get overwhelmed. You know, I'm not a natural public speaker, so I have anxiety with these kind of things. So if we know we have a kid that has anxiety, putting them in front of a group, probably, you know, again, we want to make sure they're comfortable. I think we encourage anxiety that you push them, because if we allow them to avoid or stay in their comfort zone, the anxiety doesn't go away. But we don't want to do too much, because that's going to be really more the parents, and if they're in therapy or if they're doing other things. But they may need more breaks. If they are starting to have like a panic attack or things like that, the one thing I would say is don't look at a kid with anxiety and say it's going to be okay. That's really about the last thing they want to hear, because cognitively they understand that, and so it's just kind of a reaffirmation for them that, why can't I keep this under control when I know it's going to be okay? And so I usually kind of tell parents, like, you know, if your kid's having kind of a panic or anxiety attack, I usually encourage them to say, what are we feeling? What are we thinking right now? You know, if we can get kind of that thought out of their head as to what's creating some of the anxiety, then maybe we can help them problem solve and process through it. You know, so if a kid's got to give a speech, and you can see him sweating bullets, and then you say, what are we feeling right now? And he's like, I'm going to go up there, I'm just going to say something dumb, or I'm going to look stupid, or I'm going to pass out. You know, then they say, okay, those are all really normal feelings. You know, most people before they give a speech feel that way. But, you know, let's think about this logically. You got your speech prepared, these are all friends, these are all kids you know, you're not going to pass out, you're fine. I mean, I see, it's natural to say you're fine. But you kind of want to just lie. You know, I always kind of say when we think anxiety or depression, it's a lot of those are emotions. And so in therapy, in cognitive behavioral therapy, a lot of what we try to teach people is how do you challenge your emotional, irrational thoughts with kind of more logic-based thoughts? Because anxiety and depression come from those emotional parts of our brain that try to convince us to believe things that aren't true. Logically, and if we can play on the logic a little bit, sometimes it can kind of help alleviate those feelings.
You know, also what has worked with our anxiety issues is having a safe place to go and sit down, because we've noticed that he will walk off by himself when he wants alone time, but it's not always safe for him to do so. Mm-hmm. So to have a place where, you know, if you're feeling overwhelmed, go sit on that park bench, and we'll just leave you alone until you're ready to come back and join the group. So I think it's good for leaders to understand that if you preset that up, then you're more likely to keep that kid safe.
I think it's a great idea. I do the same thing. I think we even think anger. You know, I always kind of tell kids when we're dealing with anger, the first thing you have to learn is to walk away. Because you can't just go from I'm mad and throwing things and kicking and screaming to we're going to teach you skills to stay right in the moment and go through. First step is kind of really being able to say, okay, I'm mad, I need to get away. Well, it's the same thing. I'm really nervous and overwhelmed, and if I can just get away, because some of the anxiety then comes from, well, what if other people see it? What if other people can see that I'm nervous or I start sweating, you know, then that social anxiety starts coming in. So sometimes just taking a break, you know, that's why I always tell kids a nice safe place in schools that you say, can I go get a drink of water? Or can I go to the bathroom? Because no one knows maybe where you're really just needing a break. But the same thing with anger. So if you have a group that you know tends to be rowdy and angry, you might just say, okay, remember our rules. Anytime somebody starts getting out of control, I'm going to say whatever fun little code word we come up with. And that means whoever's getting out of control goes and takes a 2-minute break in the seat. It's not a timeout, it's not a punishment, it's just a let's go cool off before we get ourselves into big trouble because we do act out those kind of things. So I use that a lot at home with kids. I think it's like we need a little code word, a little safe place. Because then once they can learn and get away, then we can kind of start teaching them skills of can we try and stay in the moment a little bit. But I always think it's fine if a kid needs a break. I mean, one of the big things we do in school is if a kid has some anxiety or depression or just gets overwhelmed is they get a hot pass. Usually it's something, just give them a hot pass. It gives them the ability to leave class. All I gotta do is hold up, teacher acknowledge that they see it, and they get to leave. So they can go find the counselor, go take a break, or they'll use up maybe two areas that are designated as a safe spot. And we don't want them to overuse it or abuse it, but it's kind of, just, or sometimes all it takes is that 5 minutes away and they can come right back. But if we had forced them to stay in it, it might end up becoming a 30-minute meltdown of just emotions and tears and stress and which we could have just 5 minutes and then right back. So sometimes it's fine to just take a break for safety, as long as you know where they're going, you can kind of see them. And just kind of letting them process. Because again, when we think about boys between the ages of whatever, 7 to 10, they're not very verbal. Their verbal skills aren't that great, so they're going to have a hard time even sharing what they may be feeling or thinking or those kind of things. And so they may need that break to kind of wrap their thoughts and get under control, and then we come and say, what's going on? One psychologist, Ross Kramer, wrote a book called The Explosive Child, and he gives talks on it. He used to say one of his favorite questions was ask kids, what's up? Because it's just safe. I'm not implying I know how you're feeling, I'm not trying to tell you, just what's up? And it gives them a nice open avenue to kind of just hopefully share. Tommy threw something, okay, now we know what the catalyst was. I think sometimes our nature is, why did you do that? Or what were you thinking? And that's just going to put them right into the defensive mode, especially if their behavior was more reactive and we just didn't see the initial, we just saw the reaction. There's just a lot of trial there. It really is.
Very good stuff.
Very good.
Tom, I've been dominating this.
I guess I have a question as far as in a meeting and child's acting up, but you really can't go up to them and say, why don't you take a drink of water right now?
Right.
So what should you
Sometimes if you know a child tends to, I've had teachers where they just like the signals if I just tap your desk. If I just do something like that, that is your signal that as your teacher and adult, I'm noticing that you're, and so I want you to go take a break and go get a drink of water. So that's why a lot of times with kids with ADHD, we have teachers sit them in the front of the classroom near them, so whatever redirection strategy they use is usually oblivious to the group. We're not having to yell at the back of the classroom or go walk back to say something. And again, I would say with kids with ADHD, and this is probably a hard one, is really working to pick our battles. If they're sitting there doing this, I know it's annoying, and maybe one of the kids will point it out at some point, but we may not want to pick that battle. Or again, if they're doing this, we may just kind of put our hand on the pen. Not say anything, not say stop tapping your pen, just a little kind of signal to it, because the kid with ADHD might be completely oblivious. They're sitting there doing this for the last 20 minutes as everybody else in the room was about to pounce on them. So usually I just kind of try to encourage, what can we do that's least evasive? So if we know that, it seems about 20 minutes into every meeting, we start fidgeting, we start squirming, it may just, maybe, look, I'm going to give you a signal. Here's our predetermined signal. I'm going to be talking on the side. And when I give it to you, I just want you to go over to, I think taking a little break will help you, because this tends to be when we get ourselves in trouble. And I think we have to go to the bathroom, get a drink of water for 2 or 3 minutes and come back. We can avoid the trouble that we've been in the last few times. So trying tricks like that.
Or plan an activity 20 minutes in.
Right. Yeah, and that's a lot of what we always talk about. When I always ask schools, that's why they do those sticker charts and those things. Sometimes they're rough because kids gets to see them. We're looking for patterns. When I ask a teacher to do that, I want times a day. I want to see, is there a pattern we can identify? Is it Tuesday at 9 o'clock, we get zeros for the last week? What's going on Tuesday at 9 o'clock? And because if we can start discovering patterns, because again, we're going to argue because they're children and they have diagnoses, it's somewhat up to us to say, can we figure out what's going on in the environment? Can we adjust the environment to help them a little bit? It's not an excuse. We don't let them get away with it. We still have the same expectation. But it's kind of, if we can say, boy, if I just did this, I think half of this would go away. Or if we try this. And then we try it. And again, and I think someone's going to be getting to know your kids. Obviously, if it's a kid you just got, you don't know, it's going to take some time. But it's looking for those patterns. And then once you discover one, kind of saying, what can we do? And again, trying to make it as least evasive as, so it doesn't stick out too much. But you know, maybe the other kids, every 20 minutes into Tommy is jumping up and down, and they wouldn't care if you said, hey bud, why don't you go get a drink of water and go to the bathroom. They might be like, great, he's going to go do that for 2 minutes and he's going to come back, hopefully a different kid, and they're not going to think anything of it. And then they'll probably just will go right over as we go 5 more minutes into the meeting or the group or the activity. So it's just kind of trying there, and I think a lot of it's getting to know your kid, and that's why I was kind of talking about therapy. We always say, I'm going to need at least 3 sessions before the kid and I really kind of even start figuring each other out, because not the same thing is going to work with every single child, even if they're ADHD. So it's, again, getting to know their personality a little bit. Some kids can be verbally distracted much easier than others, so if a kid's kind of fidgety, you might be able to just bring up a topic, or if they're getting fidgety, you might just say, hey, jump in the conversation and engage them. Other kids, they may end up doing the last thing they want to do because they're going to completely tune out. They don't want to engage in the conversation because they don't know what we're actually talking about. So that, again, we talk, don't put kids on the spot. Because an ADHD kid, if they're sitting there squirming and fidgeting, they probably didn't hear what you said, about half, and then if you ask them to answer a question, they're more likely to get some kind of behavior or some kind of acting out. They may get silly or goofy to deflect that they didn't know the answer. So also making sure, again, we just want to say, what can we do in the environment to help these kids be as successful as they can? We don't want to set them up to stand out. If we do, it's okay to say I messed up. I mean, if we call a kid out, they didn't know the answer, and he's really lost, it's okay to go up to him and say, hey, it was probably my bad. I didn't realize that you didn't catch what I had said, and those kind of things. I think it shows that we're all kind of here problem solving and working through life, and sometimes adults make mistakes too, because that'll help build that rapport and get them to kind of come back on your side a little bit. Then if we were to challenge and say, where were you at? Why didn't you get that? Why weren't you paying attention? Because again, the answer is going to be, I don't know. And that might be a fairly legitimate answer to that. So.
Well, thank you.
I hope this was somewhat helpful.